What is lipoma? A lipoma is a soft, rounded, or oval lump of tissue that forms just under the skin. Comprised of fatty tissue, it is generally mobile to the touch and typically painless. These lumps can develop anywhere on the body, but they most commonly occur on the back, torso, arms, shoulders, and neck. Lipomas are non-cancerous growths of soft tissue. They expand gradually and do not pose a cancer risk. Most lipomas don't require medical intervention. However, if a lipoma causes discomfort, a healthcare provider can remove it through a simple outpatient procedure. How common are lipomas? Lipomas are quite prevalent, occurring in approximately 1 out of every 1,000 individuals. They typically appear between the ages of 40 and 60, though they can develop at any age, including at birth. Both men and women can develop lipomas, but they are slightly more common in women. What are the symptoms of a lipoma? Lipomas typically do not cause pain, but they can be uncomfortable if they press on a nerve or form near a joint. Many individuals with a lipoma experience no symptoms. Common characteristics of lipomas include encapsulated, they do not invade surrounding tissues. Painless. Most lipomas do not cause pain, though some may be painful or uncomfortable depending on their size, location, and the presence of blood vessels. Round or oval shaped. These fatty lumps are usually symmetrical and have a rubbery texture. Movable. Positioned just beneath the skin, lipomas can move when touched. Smaller than 2 inches in diameter. Most lipomas are less than 2 inches wide, although some can grow larger than 6 inches. Where do lipomas grow? Lipomas can form anywhere on the body, though it's uncommon for them to develop on muscles, internal organs, or the brain. Most people with a lipoma have just one, but multiple lipomas can occur. They typically grow just beneath the skin in areas such as the arms or legs, back, neck, shoulders, chest and torso, forehead. What causes a lipoma? The exact cause of lipomas is unknown, but they tend to be hereditary, meaning they run in families. If a family member has a lipoma, you are more likely to develop one. Several conditions can lead to the formation of multiple lipomas, including Derkham's disease, a rare condition causing painful lipomas, typically on the arms, legs, and trunk. It is also known as adiposis dolorosa or Anders syndrome. Gardner syndrome, a type of familial adenomatous polyposis, FAP, that results in lipomas and other health issues. Hereditary multiple lipomatosis, also called familial multiple lipomatosis. This inherited disorder causes multiple lipomas. Madelung's disease, often seen in men who consume excessive alcohol, this condition causes lipomas to develop around the neck and shoulders and is also known as multiple symmetric lipomatosis. How are lipomas diagnosed? Healthcare providers typically diagnose a lipoma through a physical examination, during which they will touch the lump and inquire about any pain or tenderness. To confirm that the lipoma is not cancerous, a biopsy may be performed, where a sample of the lipoma is removed and tested in a lab. Lipomas can sometimes be mistaken for cysts. To get a clearer picture, your provider may order imaging tests such as an ultrasound, MRI, or CT scan. These tests help distinguish between a lipoma and a cyst and provide details on the lipoma's location, depth, presence of blood vessels, and whether it is pressing against nerves or other tissues. What are the types of lipomas? All lipomas consist primarily of fat, but some also include blood vessels or other types of tissues. The different types of lipomas include angiolipoma, contains both fat and blood vessels and is often painful. Conventional, the most common type, made up of white fat cells that store energy. Fibrolipoma, composed of fat and fibrous tissue. Hibernoma contains brown fat, which generates heat and helps regulate body temperature, unlike most lipomas that contain white fat. Myelolipoma includes fat and tissues that produce blood cells. Spindle cell, characterized by fat cells that are longer than they are wide. Pleomorphic, contains fat cells of varying sizes and shapes. What is the treatment for lipomas? In most cases, lipomas do not require treatment. However, if a lipoma causes discomfort or other issues, it can be surgically removed. Lipoma removal is a safe and effective procedure, and patients typically go home the same day. Alternatively, your provider may suggest liposuction to extract the lipoma. This method involves using a long, thin needle to remove the fatty tissue from the lump. Can I prevent lipomas? Lipomas and the conditions that cause them are often hereditary, meaning they run in families and cannot be prevented. However, you can reduce your risk of developing Madelung's disease, a condition associated with lipomas, by limiting alcohol consumption. What is the outlook for people with lipomas? Many individuals live with lipomas without experiencing any issues. Most lipomas do not require treatment, but if removal is necessary, the procedure is straightforward. Lipomas rarely recur in the same location after removal, although new lipomas can develop in different areas of the body. When should I see my healthcare provider about lipomas? If you notice a growth, lump, or knot under your skin, it's important to see your healthcare provider. This is crucial to rule out serious conditions like liposarcoma, a type of cancer with symptoms similar to those of a lipoma. If you already have a lipoma, contact your provider if you observe any changes, such as sudden pain, rapid growth over a few weeks, hardness, or reduced mobility when touched. Your provider will examine the lipoma, especially to check for blood vessels, which can indicate a rare and painful type of lipoma called an angiolipoma. A note from Optimalbesthealth: millions of people live with lipomas, which can be bothersome and unsightly, but they rarely cause issues. Most lipomas don't require treatment. However, if a lipoma is painful or you have concerns about its size or location, it's important to see your healthcare provider. Lipomas can often be removed through a simple outpatient procedure, allowing you to go home the same day. Recurrence is uncommon after removal. Subscribe if your body is important to you.